Good morning, everyone. Thank you for taking your time and join the information session for the diagnostic medical sonography here at Broward College. My name is Tatiana Kondratsenko. I'm a clinical coordinator for this program, and I will be going through very important details and data for our program. Before we begin, there are a few things that I would like you to do. First of all, if you didn't type your email address in the chat box, please do so. We will be sending you some very important information about the program. And second, hold off all your questions until we're done with the presentation, because I think most of your questions will be answered at some point during the presentation. Okay, so let's begin. So the diagnostic medical sonography program held at the Broward College North Campus only. The campus location is 1000 Coconut Creek Boulevard, Health Science Building 41, Coconut Creek, Florida 33066. It's in the corner of Coconut Creek Boulevard and Turnpike. The phone number for the program is 954-201-2089. And the website is www.broward.edu/ultrasound. Please pay attention and please note that the program is courses is offered only at North Campus. There are no other campuses of Broward College offers ultrasound program. Also, this presentation, this PowerPoint presentation will be posted on our website, which I already mentioned, which is www.broward.edu/ultrasound. So if you need to review some information or you need to listen that information session again, you can go to our website and replay that PowerPoint again, okay? So, so here's some important contact information that we have for the program. If you have any questions about the program itself, such as schedule, clinical hours, or vaccination, and so on, please contact program manager Evan Steigrad. His phone number is 954-201-2089, or you can contact me. My name is Tatiana Kondratsenko, and my phone number is 954-201-2079. And my email address is tkandrat@broward.edu. So the best way to contact us through email, not through the phone number, because most of the time we're not in the office. We're teaching classes. I'm at the clinic site with the students. So if you want your questions to be answered quickly, please email us. Email is the best way to reach out and the quickest way to get your questions answered. Okay. Some more important contact information. If you have any questions about the admission process, please contact Nicole Droulard. Her email address is nhowell@broward.edu. And her phone number is 954-201-2892. And if you have questions about transcript, your grades, please contact Marilyn Rule. Her email address is mrulehei@broward.edu, and her phone number is 954-201-2306. So we look at some important contact information. Now we're going to go and talk about what is diagnostic medical sonography. All right. So diagnostic ultrasound utilizes very high frequency sound to produce images of anatomy and pathology. It employs the use of the probe that is placed on the body after applying a gel. The sonographer manipulates the probe in order to transmit sound to specific locations and receive reflections from within the body. Reflections are analyzed by an ultrasound unit and displayed on the LCD screen. So pretty much ultrasound technician put the gel on the patient's body And with the transducer, which is the little probe that the technologist holds in the hand, applies to the body of the patient, and the sound waves go to the organ that it's imaged. The organ reflects the sound waves back to the machine, and that's how we get the image of the organ on the screen of the machine. That's the common idea. So what is diagnostic medical sonographer? An individual who provides patient care services using ultrasound and related diagnostic procedures. It must be educationally prepared and clinically competent as prerequisite to professional practice, demonstrating maintenance of competency through certification, is a standard of practice in sonography, and maintenance of the certification in all areas practice is endorsed, functions as a delegate agent of the physician and does not practice independently, committed to enhance patient care and continuous quality improvement that increases knowledge and technical competence, use dependent professional and ethical judgment and critical thinking to safely perform diagnostic sonographic procedure. So sonographer is not a doctor, so we don't make any diagnosis, but we work with the physician, and we help this. Pretty much our job is present the quality images, quality videos for the doctor to make proper diagnosis. So as it states here, we're delegate agent of the physician, but we do not practice independently. Sonographers provides images of areas inside the patient's body that allow physicians to interpret important medical information and diagnose disease. Ultrasound safety. There is no ionizing radiation associated with diagnostic ultrasound. Ultrasound utilizes sun energy only, although the possibility exists that biological effects may be identified in the future. Current data indicate that the benefits for patients from prudent use of the diagnostic ultrasound outweigh the risk, if any, that may present. So compared to computer tomography or X-ray imaging or nuclear medicine imaging that using the ionizing radiation that might cause cancer and any problems in the future if it's abused and used too much. Ultrasound does not have that effect as a biological effect as of right now, as we know. That's why we use ultrasound, that modality, to evaluate the well-being of the fetus, and commonly used in OBGYN settings. There are a few types of ultrasound. One of them, we look at the most common ones, is the grayscale ultrasound, is the most diagnostic ultrasound nowadays. So grayscale ultrasound displays anatomy and pathology in shades of gray, from black fluid to bright white. If we look at that image, this is the image of the fetus, where the fetus is surrounded by the black fluid, which is amniotic fluid inside the mom's belly. So we look at the head of the fetus here, at the abdomen of the fetus here, and the leg of the fetus right over here. As it states, the bright white is the bone, and we can see that indication of the skull is right here, because we can see bright white line. As well, the spine on the back of the body of the fetus is, we can see that linear structure, which will be a little tiny spine of the fetus. And all shades of gray, depend on the density of the organs, and they presented in different shades of gray. Another type of ultrasound is this 3D ultrasound that adds texture and shading effects to represent the three-dimensional data set. But widely used when patient wants to see the face of the baby before the baby is born. It's also very informative if the doctor concerned about the lips, if it has a little opening of the lip, or any like calculating of the fingers. It helps do this type of ultrasound. Also, let's go to the next one. So also we use color flow Doppler ultrasound that shows the pattern and direction of the blood flow. Here we look at the renal color Doppler, which is renal is a kidney ultrasound. Kidney is presented right here, a little bit darker than surrounded tissue around. So we can see it's darker color a little bit in the compared to the tissue right here to the probably intestinal tissue. So, and when we put the color flow Doppler, that little box right here, it highlights the venous and arterial flow for us, and that indicates that the patient blood flow, the patient has a good blood flow to the kidney in this case. There are also spectral Doppler ultrasound that shows velocity of a blood flow over the time. Here we'll look at the carotid artery, which located on both sides of our neck. And that the spectral Doppler helps us to put the little cursor in the middle of the vessel, and that's how we find the velocity of the blood flow. Like in this case, it's almost 100, so 92 centimeters per second over the time. So this is the timeline, this is the velocity. All right, so ultrasound has a wide range of application, including abdominal ultrasound, OB and GYN ultrasound, echo ultrasound, which is cardiac. Small parts is testicular, thyroid, soft tissue ultrasound. We also do breast ultrasound, vascular ultrasound, which is the vessels. Neurosonography, where techs evaluate brain and spine, musculoskeleton to evaluate joints. Interventional and intraoperative is interventional use for paracentesis, thoracentesis with the ultrasound guided fluid withdrawal, and intraoperative when the doctor does the biopsy of the, let's see, any nodule, thyroid nodule or breast nodule with ultrasound guided performance. Okay, let's look at some of these examples of the applications. So abdominal ultrasound. Here we'll look at the liver on the left side. Yeah, that's the left side. So that's a normal looking liver with the hepatic venous flow right here. And the liver has a homogeneous texture. There is no nodules seen, and compared to the image on your right side, it has multiple little nodules. It has the fluid behind the liver. So which indicates that patient probably have a multiple liver masses, which are due to probably cancer somewhere in the body. So we would evaluate not every, but most of the nodules, measure the largest one presented to the doctor and let the doctor to make diagnosis. Small parts, here we're looking at the thyroid. This is the right lobe of the thyroid. This is the left lobe of the thyroid, and the isthmus connects in both lobes. Going over the trachea right here. The trachea is a bright line because it's very dense structure, and it gives us a shadow. So the thyroid is in our neck. This thyroid looks homogeneous. There is no nodule seen. And compared to the left side image, we see very little nodule right here, which we would measure and again present to the doctor for evaluation. Okay. So OB and GYN ultrasound, we use two types of ultrasound. One is transabdominal, that's the presented on the image right here. And we also use transvaginal when the probe goes inside of the vagina, close to the uterus, to evaluate the uterus and adnexal structures. So in transabdominal, the gel is placed on the patient's body, on the belly, below the belly button. We ask patient to drink water. As we can see here, the black is water, as we discussed before. That helps us to push the uterus down. It helps us to evaluate the uterus better because the sound waves go through the water they become stronger. The sound waves become stronger, and we get a better imaging of the uterus because there are more reflections back to the machine, and we get a better resolution of the uterus. So in this case, we measure the uterus from the fundal area to the cervix. We also can evaluate endometrium, and we can see the vaginal canal here and the cervix right over here. So with transabdominal, like I said, the gel placed on the body of the patient, and the sound waves go through the bladder to evaluate the uterus. In transvaginal case, the probe is placed inside the vagina, close to the cervix, and we get a better resolution, better imaging because the probe is very close to the organ. Transvaginal imaging is done in case if transabdominal is not very well diagnostic ultrasound, because some patients can have a lot of bowel and that can hide the uterus from us. It's hard on the patient that has obese patients. It's hard for us to see the uterus. So if there are any reason, or some patient has a scar from the C-sections or anything like that, can interfere with ultrasound, and the doctor would order, instead of a regular pelvic ultrasound, the doctor in this case will order transvaginal ultrasound, because it's in this case the probe goes closer to the uterus and avoiding all this area that has a bowel around, and any scar tissue or anything like that. So we get a better resolution, better image, and better visual of the ovaries and adnexal structures and endometrium. In this case, we look at on the bottom picture, we look at the uterus that goes right over here. It has some hypoechoic nodule, which is measured from side to side, top and bottom. And that's most likely to be fibroid, which we don't diagnose, but we were gonna describe what we see. Hypoechoic nodule measures this and that on the posterior wall of the uterus. And we can evaluate endometrium as well, measure endometrium for the doctor to, again, make the proper diagnosis. On the top image, we see the pregnancy, with the twin pregnancy with the two little fetuses in there, surrounded by the fluid, amniotic fluid, and gestational sacs right over here. And this probably like 8 or 9 weeks pregnancy that will give us approximate day of delivery. That's the best time to measure the fetus, because they're all before the fetus become 3 months old. They all fetuses in every woman body grow pretty much the same. So when we give the doctor measurement from the bottom to the top of their head, it's let the doctor estimate the delivery day and how far away in the pregnancy the woman is. So next type of ultrasound is echocardiography. We have a normal heart on our left side. We look at the left ventricle, right ventricle of the heart, right atrium, left atrium, and the septum between two ventricles, septum between atria. The walls look nice and thin. The chambers look not enlarged. The heart look healthy. On the right side, we look at the patient with amyloid deposit. We can see little bright lines here in the heart. The septum compared to the septum is much thicker. The walls of the heart is much thicker compared to this wall, which is very small and tiny. So the chambers, if you compare right atrium to this right atrium, the atrium is enlarged, left atrium the same is enlarged. And we also can see the pericardial fluid around the heart, which is not seen here. So this is how we indicate the pathology. Again, we present it to this doctor. We describe what we see: enlarged atriums, left ventricular hypertrophy, pericardial effusion, and doctor will go over our notes and compare that to what he sees and make proper diagnosis. So echocardiogram, the same as the OBGYN ultrasound. If we don't get clear imaging through transthoracic, this image is done through the applying the gel to the left side of the chest wall and go between the ribs. We place our probe like between the ribs and trying to get that images. So if for some people have COPD, lung problems, some people have just anatomically hard to evaluate the heart. Some women have a breast implants. There are many reasons why we might not get a good visual of the heart and our images will be limited. In this case, the doctor would order transesophageal echo versus transthoracic echo. So in transesophageal echo, the doctor places the probe inside of the esophagus and the tip of the camera goes closer to the heart. And this images gives doctor high resolution images because the probe is closer to the heart, and the technologies in this case will help the doctor will hold the probe in this case, and the ultrasound technician would be right next to the doctor and just um, follow the commands that doctor asks for technologists to do. For example, if the technology asks the if the doctor asks the technologist to place the color Doppler on the any valves and see if it's any leakage of the valves, or if the doctor asks to measure any atriums or ventricles, that's what the technologist would do. The technologist would assist the doctor with the imaging controls. So next type of ultrasound is the vascular ultrasound. That vascular is done to evaluate arteries and veins of the patient's body. So for arterial flow, we look if it's any calcifications, if it's any obstruction in the arterial flow that causes the increase in the velocity, and if it's any occlusion, which causes not enough blood flow go to the specific area or specific organ. Very common with the people who smokes, like their arteries in the legs get occluded because a lot of calcification build up and patient does not get enough blood flow to the toes, and toes get necrotic and can be the dangerous conditions. So the doctor wants to evaluate the iris before it comes to that point, if it needs to be clean or anything like that. Vascular also done for venous ultrasound, where we'll evaluate if it's any blood clots in the veins that can move to the heart and cause the heart attacks or cause the stroke. Very, very dangerous condition as well. So ultrasound become very handy and gold standard for evaluating blood clots. The most important modality. So in this image, we look at the carotid artery. We look at the blood flow and just like I said, presented to the doctor. So we'll look at the most common modalities. Now let's talk about sonographers. They utilize the state-of-the-art equipment to ensure high-quality diagnostic information. Sonographer's job description is to obtain, review, and integrate patient history and supporting clinical data to facilitate optimum diagnostic results. So sonographers gather all information that they can get. We ask patient the symptoms, what's going on. We talk to the patient through the procedure. If we see something unusual or abnormal, we ask questions, and all information that we can get from the patient, and the information that we can get from the patient history just found through going through the history, we put in our paperwork just to help the doctor to make the diagnosis. Also, sonographers perform appropriate procedures and record anatomic, pathological, and physiological data for interpretation by the physicians. So regardless if it's abnormal or normal ultrasound, we present all images to the doctor. We have a protocol that we follow. the images that we have to present, and every place has their own protocol. So we have to obtain all necessary images that the doctor thinks is necessary to make diagnosis. Also, sonographers record, analyze, and process diagnostic data and other observations made during the procedure for presentation to the interpreting physician. I already discussed that. Exercises discretion and judgment and performance of sonographic or related diagnostic services. Demonstrate appropriate communication skills with patient and colleagues, which is very important. Patient come sick, of course, if patient came for the seeking medical advice or came for the study, so there is some kind of problem, and the patient, some patients are nervous, some patients can be upset. So communication skills is very valuable, and sonographer should be able to talk to the patient respectfully, and of course to colleagues the same way, because keeping nice atmosphere in your working place is a must as well. Act in a professional and ethical manner. That's self-explanatory. Facilitate communication and education to elicit patient cooperation and understanding of expectations, and respond to questions regarding the sonographic examination. Okay. Physical requirement. Strength sufficient to lift, turn, or position some patient, push ultrasound equipment on the wheels. Machine can weigh up to 300 pounds or more, and move patient in wheelchairs and stretchers. Moving the machine that it's 300 pounds, now the machines are getting lighter. Even though if we have to push the machine that 300 pounds, it's on the wheel, so it's not that much strength, honestly. What takes a lot of strength is to lift and turn the patient. So we teach students at school how to do it properly in order not to damage their body as well, their back, their knees, and that's where a lot of strength goes, lifting and positioning patient, or move the patient from the bed to the wheelchair. So that's all has to be done properly to evaluate any future problems. Ability to maintain prolonged arm position and wrist flexion necessary for scanning. It's the more appropriate for echo ultrasound, because in the echo ultrasound, patient lays on the left or right side, and our study takes about 32 an hour. And the tech, when it's find the window, and that window is so good, and you don't want to lose the window because it's very good visual of the heart, then the tech keeps holding the wrist in the same position, and that position might cause some problems in the future. So again, we go through that with the students, and how to explain how and when it's appropriate to take the rest for the wrist. And but anyway, the tech should be able to hold that position in order to acquire the images that needed. Possesses manual dexterity that is adequate to manipulate and operate all sonography equipment. Possesses visual skills necessary to adequately differentiate between subtle shades of gray and make color distinctions. We look at the kidney. Previously, kidney has slightly different shade of gray from all organs around it. So the tech should have a good eyesight to differentiate those shades of gray, because some of the nodules or some of the masses, which are very dangerous masses, can be pretty much the same texture, it's pretty much the same color as the tissue around it, and we should have that eyesight to let us to differentiate that subtle little difference in the shades of gray. So that's very important for proper diagnosis, and not diagnosis in our case for proper presentation of the pathology if it's present. So important skills and attributes: desire to provide respectful, compassionate, and consistently excellent patient care, extensive knowledge of anatomy and pathology, good hand-eye coordination and spatial orientation, comprehensive knowledge of ultrasound physics and instrumentation, detail-oriented work ethics. That's to summarize, which skills are the most important in ultrasound world. Now, qualifications, graduate of a formal diagnostic medical sonography program or cardiovascular technology program that is accredited by the Commission on Accreditation of Allied Health Education Program is required. The Broward College Diagnostic Medical Sonography Program is accredited by Commission of Accreditation through the Joint Review Committee on Education in Diagnostic Medical Sonography. So in order to get your license in ultrasound, the school that you will decide to go must be accredited by the Commission on Accreditation of Allied Health Education Program. So if the school you go for to get your ultrasound license is not accredited, you won't be able to get your license. So our program is accredited, which is really good. So after graduating, you will be able to sit for the exam and get your certificates and everything that need to be a ultrasound technician. Required license and certification, access certification by the American Registry for Diagnostic Medical Sonography, which short with ERDMS, in specialties as appropriate, current compliance with continuing medical education requirements set forth by ERDMS, currently 30 CMEs per rolling triennium. So what it says here, after getting your license in ultrasound, you will be getting your certificates. A license that just states that you can work as an ultrasound technician. Certificates gives you the area in which ultrasound can work. So there are different type of certificates, ERDMS certificates, such as, for example, abdominal certificate, OB/GYN certificate, cardiac certificate, fetal cardiac certificate, pediatric cardiac certificate. So that's all different areas where students or future technologists choose to work. But in order to work in that specific area, they have to get their certificate. So having license in Florida is not enough. Some states might accept just you having license and not having the specific certificates, but in Florida, you have to have your certificate in order to work in any medical facility. So if you decided to go with if you decided to work in the OB/GYN world, if you want to work in the OB office, you have to get your certificate in OB in order to work in the office. That's what the certificates are for, ERDMS. Now, CMEs, 30 CMEs, it means every 3 years, we have to renew our license every year. So every year we go on the ERDMS website and we pay for our license renewal and get our license renewed. But at the end of the 3rd year, we have to submit 30 educational units, 30 CMEs. Educational unit states that you've been educating yourself and keeping everything on top of the game, that you know what you're doing, you know new requirements, you know new standards. That's what the CME is for. And CMEs, depending where you ended up working, it's easy to get them because some hospitals offer classes which you attend and you get your CMEs done. You can go online and get your CMEs, take some, read some material, take a little test at the end, and get your CME certificates. There are many ways to get those certificates, but every 3 years, by the end of the 3rd year, you have to submit those 30 CMEs for ERDMS to keep your license active. That's what CME is for. So let's look at the ERDMS registries and specialties. So registered diagnostic medical sonographer with specialties offered in abdomen, OB/GYN, musculoskeletal pediatrics, and breast. So if you register as medical sonographer, you can get your certificates in all these areas through the ERDMS. Like I said, abdomen, OB/GYN, musculoskeletal, it's a joints evaluation. pediatrics, abdominal, general, and breast ultrasound. Also, UDMS offers registered cardiac sonography certificates, which can be adult cardiac, pediatric, or fetal echocardiography. And also, ARDMS offers certificates in vascular. Oh, I'm sorry. I need to drink some water. And vascular technology. So this is certificates that are offered by the ARDMS. If the tech and interested in any other certificates, then there are any they can find different organization they can offer the certificates. But this is the major ones, and any sonographer can get their certificates done there. So sonographers can provide these services at hospitals, outpatient clinics, physicians' offices, research facilities, or may become independent contractors, application or sales specialists for equipment manufacturers, educators, and consultants. So it's a wide variety where ultrasound technologists can end up working. Hospitals is the place where a lot of ultrasound tech works. So after graduating, a lot of students have possibility work at the hospitals, because hospitals is the one that likes to hire students, because they like to train them from the beginning the way and make them the way they want them to be. So they want them to learn their protocol instead of having techs that have a lot of experience, for instance, and come with the protocol set in their mind, and it's hard to change their protocol. It's easier for them to hire students. So a lot of students who graduate ended up working at the hospital and get the experience. So outpatient clinics offers a lot of jobs for sonographers as well. Physician offices, usually 1 or 2 sonographers work at the physician office. Usually it's cardiac or OB office, and on these cases like abdominal or general ultrasound, the doctor's office sends their patients to outpatient clinic to do their ultrasound. But physician's offices, it's usually cardiac or OB offices, and research facilities that want to do research, and like for instance, they come up with a new machine and they need the ultrasound technologist to come and give their opinion about the resolution, the imaging, and so on. And that's the field where the ultrasound technologists can work. So let's move to the next one. Employment outlook. According to the Bureau of Labor Statistics, employment of diagnostic medical sonographers is expected to grow by 14% between 2024 and 2030. This percentage is much faster than average for all occupations. As ultrasound technology evolves, it will become a more common method used to assist in diagnosing medical conditions, favored over more invasive procedures. Since ultrasound does not cause any ionizing radiation, it's very safe modality for right now. A lot of research is put into developing new machines with the better resolution, with the better imaging. For instance, if we take like 20 years ago, we could not evaluate the brain and muscles or any musculoskeletal structures. And nowadays, it's so popular, ultrasound of the musculoskeletal, to see if it's any torn ligaments, if it's any fluid in the joints or anything like that. So nowadays, they come up with a machine that can evaluate it. So there are a lot of research put in developing new machines. So it's always will be demand for ultrasound technologies, because the field is becoming bigger and bigger. It's relatively it's a safe modality, and that's what dictates that changes and the improvement of the technical stuff. So competitive salary, sonography salary from Bureau of Labor Statistics as of 2023. The average salary is $78,210 per year, or $37.06 per hour. It's all depend where the techs ended up working and what benefits they got offered also. So like if the technologist has a lot of experience, ended up working in a small physician office doing just echoes or doing only OB/GYN studies, they might get higher pay than this, but they might not be offered the benefits. So it's all depend. It can go from $35 per hour to $50 per hour. But we look at the average here, and average is 37.6. Now we're going to the next chapter. So we're done with the reviewing the ultrasound, what ultrasound is, what is the what type of ultrasound we use, and what in which fields the ultrasound technologies can work, and requirements for ultrasound technology. So now we go to the next chapter, which is program requirements and admission. And a lot of you might have questions in the end of the session, so you will be able to ask those questions. But let's review it, and maybe some of your questions will be answered, okay? So courses to be completed before applying to the sonography program is applied physics, radiographic physics, or radiographic physics, I'm sorry, algebra, college algebra, college algebra with prerequisites, composition 1, introduction to speech communication, and introduction to public speaking, anatomy and physiology 1, anatomy and physiology lab 1, anatomy and physiology 2, anatomy and physiology lab 2, general education humanities, and history of United States since 1877 on national government. So this all prerequisite classes must be completed before you apply to the program. It's very important. It does not matter when you apply to the program, and the application period is open right now till March 15th. So if you haven't completed one of those classes, and you still have time, if your class, let's say, already started this semester and you will be done by March 1st, then you still have time to, even if you apply on March 15th, which is the last day of application day, you still will be able to get in the program if you have a high amount of points compared to other students. So all these prerequisite courses must be completed before applying to the program. Additional points awarded will be if you completed any radiography program, you get 20 additional points. If you have associate degree in health science, you get 17 additional points. Oops, I'm sorry. If you have a master's degree, you have 15. Bachelor's 10 points, and associate 5 points. And also your GPA, depending on overall your GPA, your points will be calculated accordingly. So you can look at that table. So application period started in November 1st, and it will be over in March 15th. So you still can apply on March 15th. The application period is open right now since it's January, and we still have 2 months before the application period ends. So March 15th is the last day. The program itself, if you get into the program itself will begin in June. At the end of June, I think this year begins June 25th or 26th. It's Thursday, whatever the day is. Let me look just to be 100% sure. So June 26th, 26th will begin this year if you get into the program. So application period is not till March 15th. If you got into the program, we will hold a meeting sometimes in the middle of April. So by the end of April, you will know by the beginning of April, you will know if you were accepted into the program. And sometimes in April or beginning of May, we will hold a meeting for those who got into the program and discuss everything that needs to be completed before your first day. And the program this year begins June 26th. North Campus again, North Campus only. There is no other campuses offering the ultrasound program. Admission requirements: once all prerequisite courses are completed and graded, you can apply to the program between November 1st and March 15th of each year. This is the link if for admission. So all students must have a minimum GPA of 2.5 to be eligible for admission. So if your GPA lower than 2.5, the computer system will just kick you out. We won't even see your application. So if you have your GPA lower than 2.5, don't even apply. And admission, like I said before, is based on the point qualification system. There is no waiting list. So if for some reason you didn't have a chance to get into the program, you were just like a couple points lower than the your opponents, then next year you will have to apply to that program again. We don't put people in the waiting list, and we don't say like, oh, you didn't get this year, you will get into next year since you were so close. No, it doesn't work that way. So it's all depend on the amount of points you have. And whoever get the highest amount of points, those students are able to get into the program. We take 20 students every year. So very important, please make sure you complete your prerequisite courses. You want to have the highest amount of points to make sure that you get one of those seats out of 20 people that will be getting into the program. Okay. So once accepted, physical examination immunizations is required, including all vaccinations. So it's not Broward College requirement. Please pay attention to that. It's a hospital requirement, and completing the clinicals at the hospital is part of the program. So if you and part of you getting your license, for you to sit for the examination, you have to have a theory and you have to have enough hours to practice. So if you don't have hours to practice, you can sit for any examination as it gets your license. Every hospital, every medical facility requires our student to have their child immunizations, such as rubella, measles, mumps, hepatitis B, varicella. I think I named all of them. And as of right now, as it states here, the COVID-19 vaccine is not mandatory anymore. But flu vaccine is mandatory. So every year the student have to have their flu vaccine for the flu season, which they usually get in September. So 2 flu vaccines will be done during during the program, because this is a 2-year program. So first September and next following year, September, the flu vaccine must be, it's mandatory for each hospital. But COVID-19, like I said before, is not mandatory anymore. If you have it, that's good. You're gonna, they do have a question when you go to the hospital, if you do have a vaccine or not. If you do, you say yes, and you put the dates when it was administrative way. If it's not, that it's fine, you just answered no, I didn't have that vaccine. But in case if something happens like that, like COVID-19 that happened, now it's what, 2025, 5 years, almost 5 years ago, not almost 5 years ago. So if something like that happens again, it will make students to sign the waiver. So in case if any other diseases, or let's say COVID-19 becomes pandemic again, and the hospitals require students to get it in order to continue their education at Broward College in diagnostic medical sonography or any health science programs, the student has to follow the hospital requirements and get that vaccine done. So you will sign the paper that you agree with that, in case if any requirements like that comes in the picture, that you will be able to get the vaccine done. So hopefully it's not going to be the case. It didn't happen for a long time. So we don't think that anything is coming like that anytime soon, but you never know. So we need to make sure that students are willing to go with that and complete the program. Also, student must complete certifications in areas such as CPR, TB, OSHA, that offers, you can all find online. It's a lot of places offer those certifications, and they don't cost much, maybe like $25. And also we do background checks and drug screening. It's also requirements. So we have zero tolerance for drug screening. If your test result came back positive, you won't be able to apply to any health science programs ever in Broward College. So it's very important that your drug screening is negative and background check is negative as well, because none of the hospitals will accept our students if their background checks come back with the red sign with the alert. So this is all the requirements if you get admitted to the program. So we will go over that as well when you attend that first meeting in late April or early May. We will announce the date after accepting you into the program. So let's summarize. So specialized sonography courses begin in June 26th this year. 34 hours per week is spent in classes and clinic. This does not include study time. We will look at the schedule in the next slide. The DMS Associate in Science degree is awarded upon completion of the 2-year course of study. So this is Associates in Science program, not the bachelor program. Graduates are eligible to sit for the year DMS registers in abdomen, OBGYN, and adult echocardiography. So after completing our program, you will be able to get your certificates. If you remember, we talked about different type of certificates. There are many of them. You have to study for all of them separately. After completing the program at Broward College, you will be able to get the certificates in most common and broad areas such as abdomen, OBGYN, and adult echo. And then in the future, if you decided, let's say, work in the pediatric echo instead of adult echo, you don't have to go to school, or all you have to do is study at home and practice at your medical facility where you work, because let's say they want you to become pediatric echo, they let you practice at the medical facility. They will sign the paper that you have enough hours to that you practice enough hours, and you can go ahead and sit for your examination. You don't even have to go through school. Or let's see, same with the breast ultrasound. If you decide to become an ultrasound tech and doing breast ultrasounds, again, you study on your own. You ask your medical facility where you work to sign the paper that you have enough hours, practical hours at the facility. They will sign your paper, and you go to your DMS and take the examination and get your certificate. So as long as you get your license, you need to go to school to get your license first. And then we offer certificates in these areas. And then after these areas, you can get in certificate in these areas. You can get more and more certificates, whatever your decision is. All right, so now let's look at the schedule. We discussed everything that it's prerequisite classes. So program prerequisites is a separate column and area right here. We're not going to talk about that again. If you want, you just take a look what is the prerequisite classes are. So let's talk about the program itself, the schedule that will be. The schedule is set for every student, and the year for every student, the schedule will be the same every semester. When I say for every student, it's the class hours will be the same for everybody. So you would come to Broward College, you will come to you will be at the same time, same day, same time every day. But for your clinical hours, the hours can vary depending on which clinic you ended up going. So every student every semester will have their schedule, which they have to follow. You're not allowed to pick any classes, you're not to pick any clinics. It's all the way the program is set up. That's you're gonna follow the program rules. That's how it is. So let's look. The program begins, like I said, June 26, 2025, this year. And it will end for this cohort, it will end May 2027. So in 2 years, it's pretty much 2-year program, a little bit less, like 20 months instead of 22 months, instead of to be 24 months. Because it begins in June and it ends in May, but 2 years later. So the first term During the first term, the students will not go through the clinic hours. They do not go through the clinic. They study at school only. They will have one class on Wednesday, which is circulatory system, and two classes, principle and protocols, and sonography imaging, which is lab. So that will be 2 days a week. The schedule is not set yet, depending on the professor availability. Last year it was Tuesdays and Thursdays. This year might be Tuesdays and Fridays. We will let you know when you get into the program. But term one is the student will spend 3 days at school. Regardless what days, it can be Monday, Tuesday, Wednesday, Thursday, or Friday. We will set the schedule when it comes close to that term. So, but it will be 3 days a week from 8 o'clock or 9 o'clock till 4 o'clock. So 8 hours a day for each class, 3 days a week. And like I said, the schedule will be set and you cannot choose your own hours. You will follow the whole class comes at the same time and study at the same time. During term 2, 3, 4, 5, and 6, student will start going through the clinics. They're going to have 3 days of clinics on term 2, 3 days of clinics on term 3, 4 days of clinics on term 4, 3 days of clinic on term 5, and 3 days of clinic on term 6. So every term is 3 days of clinic except the term 4. Also, during the term 2, students will spend 2 days in school. So altogether, you have 5 days of school in term 5, or in term 2, 5 days of school in term 3, same schedule, 3 days of clinic, 2 days of school. And school will be Tuesdays and Thursdays. The schedule is set for those days. So term 2 and term 3, Tuesdays and Thursdays at school. And the rest of the week, 3 days of clinic. Term 4, you will have 1 day of school and 4 days of clinic. The school will be on Wednesdays. Term 5, same 1 day of school on Wednesdays and 3 days of clinical. So term 5 and 6, the same, and you have 4 days of school versus 5. Term 2, 3, and 4, 5 days of school. Term 5 and 6, 4 days of school. So 1 on campus, and 3 days at clinic for both terms. So now let's look what classes you're gonna have in term 2. You're gonna study physics, abdominal sonography, and OBGYN sonography, where you're gonna learn how anatomy looks in ultrasound, and you're gonna have lab where you will be practicing on each other, scanning each other, and the clinical education, which is the clinics, when you're gonna be out in clinics practicing. Term 2, you will continue study physics. Physics is the subject that you're gonna take when you're gonna get your license. When you're gonna after in term 4, you will sit for your license, and the questions that you're gonna go through is gonna be the physics questions. OBGYN sonography and abdomen sonography, you will be studying pathology. First semester study anatomy, second semester study pathology, and you're going to have a practical aspects of sonography where you will be reviewing everything that you study in term 2. And it's going to be an online class, and you're also going to have lab where you will be scanning each other, and again, clinical when you're out at clinic. Term 4 is going to be 1 day a week. You're going to study small parts sonography, anatomy and pathology all together, and clinical education as well. And term 4, it's going to be 1 class on Wednesday where you will be studying echo ultrasound, the ultrasound of the heart anatomy. And you're going to have a lab where you will be practicing on each other, and you're going to have a practical aspects of sonography too, where you will be reviewing everything that you study in term 2. Again, that's going to be more likely online class. Sometimes you meet on campus, but on the same day on Wednesday after the echo class and lab. And you're going to be at clinic 3 days a week again. In term 6, you're gonna study again echocardiography. You're gonna study pathology in term 6, anatomy in term 5, pathology in term 6. Again, you're gonna have lab continue improving your skills, scanning skills, and seminar in sonography will be after class on Wednesdays, after those 2 classes. And you will be reviewing everything that you study in term 2 and 3. We would try to get you ready to get your certificates in both that areas, and abdominal and OBGYN area. So after completing term 3, going to term 4, you will try to get your license. Not try, I hope that's students usually get their license during the term 4. Sitting for SPI exam, which is a physics exam. They get a license, and after completing term 5, going to term 6, after the spring break, they're working on getting their certificates in abdomen and OBGYN. And after completing the term 6, they can sit for their echo certification and get their certificate in echo. So this is the schedule for 2 years. Now, I want you to pay attention to clinical hours. Very important. So with clinical hours, we have hospital medical facilities that work on the weekends during the week. So the students will go through the rotations, and the clinical coordinator, which is me, will decide, depending on what needs to be done by the student, where the student goes. I do not take any of any of that student. If the student wants to go to a specific hospital, there is no way that I can set the student with what their decisions are. So I have to follow the program rules and follow what it needed for the student to be completed. So you have no choice of clinical sites. I will choose which site you go. It can be on the weekend. It can be during the week. It can be from 8 till 4. It can be from 2 to 10:30. It can be from 7 to 7, 12-hour shifts. In this case, the student will go to clinic twice a week instead of 3 times a week. It can be any shifts. And unfortunately, I can't accept, I cannot ask students because what hospital they go, because we don't have, we do have a lot of hospital that we work with, but we also have a lot of students and a lot of days a week. And some students can practice more abdomen during the one rotation, then next rotation they need to practice more OBGYN. So I need to make sure that the student covers all the areas, and I follow that requirement that everything needs to be covered. So I cannot place the student what is the closest to the house or anything like that. So please be aware of that. So it can be the clinical rotations, like I said, would be 3 times a week, can be 4 times a week during the term 4. It's 4 times a week. And you might end up to be in the hospital. They might be far away from your home, but it's going to be only for 1 semester. So your schedule for clinical rotation will stay the same during the 1 semester, and when you move to the next semester, it will be different clinical rotations. So every term you will go through the different hospitals. You won't come back to the same one, and that the other thing that it's impossible, and usually go through the 2 hospitals in the same term, so 2 different medical facilities. So you ended up going through almost 10 facilities. So it's impossible to find 10 that it's close to your house anyway. So you ended up going away from your place where you live. So be aware of that. Okay. You can ask me any questions when we done with that.
So tuition and fees. The cost of the program is $14,088.80. It stays the same for many years. It's I think it's the lowest cost of the program compared to other schools. So the price is pretty good. You can look at the breakdown, what you pay for on your own, and uh, I think it's very affordable, and you get in a lot of you get in your license and you get in certificates in their areas for that price. So now why choose the Broward College sonography program? 90 to 95% of Broward College students pass their DMS registry examinations, so we prepare them very well. The program is very strong. There are a lot of material that we cover in class, and students usually have no problem to pass their registries. And we have pretty good outcomes, the passing outcomes that a lot of students pass the exams. Also, 95% of Broward College sonography students that successfully pass their DMS registry examination are working in the field. Now, we have a lot of students that find the job before they even graduate, because don't forget, going through the clinical rotations is your job interview. If the clinic side likes you, they might ask me, they might request and ask me to bring the student back, and I gladly do so. I'm helping student as well. If the clinic side requests the students back, and the one to hire that few students in the future, I'm gladly placing that student back at the same place that the student went, if the student agree with that, if they interested. So a lot of students find their workplace even before the graduation, which is great. Also, a few more good reasons: instructors with over 35 years of combined ultrasound experience. Small class sizes, we have only 20 students, so every student have a chance to practice. We have a lot of ultrasound machines, I think about at least 10 of them. So at each station, one can be scanned, one is scanning. So, and then students rotate, they don't have to wait long to scan each other. So that, which is small class sizes, is great for the practice. Comparably lower program cost, we talk about it compared to other schools around. You can check online and everywhere. The cost of the program usually around 40,000, and ours is 14,000. So it's relatively affordable compared to all other schools. Also, Broward College has graduated excellent sonographers in our community for over 30 years, and so we've been in that field for quite a while. State-of-art lab incorporate Philips advisors and HD11 scan stations as well, Bitmax and ultrasound simulators. What it says that for some studies that cannot be performed on the students, such as testicular ultrasound or transvaginal ultrasound or OB ultrasound, because we don't have so many pregnant students, or if even if we do want, then I doubt it that the students want to be scanned constantly by the students. So in this case, we have simulators in class, and students can practice in class by scanning those simulators and get their skills improved. Comprehensive clinical training in Broward finest hospitals and clinics. We work with all biggest hospitals in Broward County. We don't go outside of the Broward County, by the way. I didn't mention that. So when you ended up going through the clinical rotations, it's going to be in Broward County and a little bit of Palm Beach County, but up to the Glades Road. So we don't go further than Boca. And we don't even have many clinics there, only for echo, 2 clinics for echo, but otherwise we work only with the Broward County hospitals and medical facilities. So we don't cross that border. So you're not ended up going to West Palm Beach or going to Miami or anywhere there. If you live in Broward County, so every hospital is going to be relatively close to your house, maybe 20 or 30 minutes away is the furthest one. So we work with the Broward Health System, we work with Memorial Health System, we work with HCA hospitals. These 3 the biggest hospital chains. And we also have a lot of medical facilities and that we work with. Okay. All right, I think we're all set. So we covered everything in the session. Again, if you at some point have any questions, you always can check our website, which is www.broward.edu/ultrasound. If you forgot the website, you just type Broward EDU and the search box, which is in the right upper corner, you type ultrasound and it brings you to our website. This PowerPoint will be posted there as well, so you can always review this PowerPoint. You can get the information from that PowerPoint if it's necessary. So now we're open for your questions. If you have any questions, please type your question or speak up, whatever works for you.